Well, thank you so much, Dr. Schultz. Dr. Schultz is the Chief Medical Officer for Shannon Clinic, or Shannon Hospital, the Shannon Hospital System here in San Angelo, Texas. More importantly, he was my pediatrician, and he graduated from my alma mater at Trinity in San Antonio. I wanted to talk to you and ask you a little bit about how Shannon has responded to the coronavirus and what steps you've taken, and how do you think the community has responded to that?
Okay. You know, one lucky thing for us, we had the advantage of, seeing what was happening on the East Coast and the West Coast early on, so we could. It wasn't happening in Texas yet, so we had the advantage of being able to plan ahead, instead of trying to just react to as things were happening. So really pretty early on, early March, we started planning for a telemedicine product we call Shannon On Demand, where people can go on telemedicine. We provided a free coupon. It's called a COVID coupon, and so people could go on there and get a free visit on telemedicine if they were concerned. So we started that early on, and then spring break happened here in early March. So all the kids were let out of school. And during spring break, the school districts decided, hey, let's extend spring break. And in reality, they never came back.
Exactly.
So now they've closed schools for the rest of the school year in Texas. So at least here, we had, in essence, closed things down, really due to spring break. So a little bit of luck there.
Yeah.
And then really the mayor here in town, same way. They early on closed the restaurants and bars really earlier than, because our first positive COVID case was April 24th.
Okay.
So really pretty,
March.
I'm sorry, March.
Yeah,
Misspoke.
sorry.
March.
That's really good.
Yeah, I'm sorry. March 24th was our first case, but by March 24th, we had already formed a physician task force. So we were studying all the things that were going on in New York, how they were treating the patients medically, what medications they're using, what type of ventilators, all the different things they were doing, so that we were prepared medically. Yeah. We opened what we call a COVID ward here, which is a ward just for our patients with suspected COVID or COVID. So all the nurses were trained and the doctors working on that unit, same in ICU. And then our CEO, Shane Plymell, really worked hard to obtain supplies, because the supply chain across the United States was
competing with each other.
And he did a good job of continuing getting us plenty of masks and gowns and gloves and all the things that we needed to be ready, and ventilators too. So we really were good from the beginning. And then March 24th was also the same. I think that's the same day that elective surgery. Yeah, it was the same day that the governor of Texas, Governor Abbott, stopped all elective surgery, which was really meant to save on supplies and provide more beds for COVID patients. So, and that's the day we had our first case. So we really shut down surgery, and again, all the kids were home and people were starting to stay home because the businesses were closed. So all these things kind of went together, I think, to put us in a good spot where people were social distancing. We were actually doing videos at this point. Our CEO Shane and myself, we put out a video almost every day, which went to we put online on Facebook, as well as we gave it to the media to use, and it was informative to the public, to what they could do and things like that. Let's see, what else did we do? We also started a drive-through testing center around that time. Yeah, it's still there, and that allowed patients who need to be tested in the proper way, where our personnel had all the different protective equipment they had on. We didn't have to have every office trying to do it, individually.
Centralize it to one location, to also alleviate people's fears of, hey, they're getting testing here, I don't want to go to the doctor. Yeah,
they could just talk to the doctor on the phone and then drive through, get tested, and go back home.
And how many tests have you administered here?
Well, you know what? I think it's around 900 or something like that.
Okay.
We were doing at one time almost 90 to 100 a day. Yeah. But that number's decreased drastically. Now we're probably doing more like 30 a day. So the number of people driving through has continued to go down. Partly because the flu season ended, and so I think a lot of people were driving through it first that probably had the flu, had fever and cough.
I think there's also a want and need to make sure that you're okay.
They want to know, so they would have we were using the CDC guidelines, so you had to have certain symptoms to get tested, and that's what we did. And really, we to this point, the number changes all the time, but I think right now we're right around 50 positive cases in the Tom Green County.
And then one death.
Total. That's a total for the entire
That's incredible
time. So it's a very low number.
Incredible.
Compared to New York. And so of that number, only a few have been hospitalized. And we did have, unfortunately, there was one fatality, but that's the only one. And it was an elderly gentleman who had multiple other conditions. So it fits in the category of very high risk person. But all the other people have gotten better and gone home. And currently we don't have anybody in the hospital that's positive. We do have some that are pending tests, tests, but not back yet.
When was the last positive test?
We had a positive test, I think just yesterday in our drive-through, but in the hospital we haven't had any in probably several days, I don't think.
Good. And you mentioned all the good things that Shannon has done to be as ready as you have been. It seems like San Angelo has been doing better than even Midland, Odessa, Abilene, other cities. Not even comparing it to New York City or to San Francisco or even Louisiana, where it's just the hotspot. Why do you think that is, that San Angelo has fared that much better? Or maybe not that much better, but better than...
I think there's I don't have the right answer for that, but just some thoughts would be that we don't have an interstate, we don't have a dense population. This is extremely, San Angelo itself is a city, obviously, but surrounding us is a very large rural population with a lot of sheep and goats, not that many people. And so that takes away the population density, that you have in a large metro area. We don't have a lot of mass transits. There's no subways, things like that, right? So people are in their own cars, going here and there. The population is, we do have older people, obviously, but it's a diverse population where there's a lot of young people as well. So it's not, a retirement city per se. And then I think the thing I think may be important is we didn't really have any major events where a lot of people came together. Our biggest event is the San Angelo Rodeo, the last biggest event that we had. It was in really part in February, and there were no cases here yet. So there was a lot of people with those rodeos. But after the rodeo was over, there were no more mass events like Mardi Gras and things like that, where I know New Orleans had Mardi Gras. And then Austin was going to have the South by Southwest Festival, which they canceled. Which was very smart looking back on it, but when they canceled, I think a lot of people...
That raised eyebrows.
Like, why are you doing that? I mean, it's not a problem, but again, probably pretty smart of the Austin mayor to do that. So I think all those things kind of work together to, and then, if you look at the map of Texas, you can see that the more dense populations of the I-35 and Dallas, Fort Worth area, and then Houston are the higher concentration of cases. In Austin to San Antonio, a little bit on that corridor going between San Antonio. But when you go to the west, you just don't see
the benefits of not being so populated.
So I think it's all, some things we're lucky, some things we prepared for and did well, and it's just a combination. But I think it's important to realize, I mean, it's a virus, and it still is around, and it may, I think Dr. Fauci said the same thing. It may dissipate during the warm weather, but it may come back next fall, and we'll
have a second wave that may be worse than this.
May well happen. So even more important that we prepare and be better prepared if that happens, with better supply chain and hopefully some drugs that have been will be good, and also theoretically a vaccine at some point.
So, in your expertise, what do you think the new normal will look like, and do you even have a time frame for that?
I think the social distancing will be in place for a while, so that'll be a part of going to restaurants or any kind of business where you'll keep that distance, because that clearly, there's some disagreement, but I think it's pretty clear that if you cough, the virus is only going to go so far, unless you just have a gigantic super cough. So keeping that distance is going to be important. I think people will probably wear masks for a long time when they go out. Of course, we still want to do good hand washing, and people will probably continue to do that, I think, for a long, long time. Yeah. And that's all good stuff. That's good for any virus, not just coronavirus. It'll be good for flu and other infections. So it'll be a good habit for people to get into. So that'll be part of the new normal, I think. But healthcare needs to go on. I mean, people have to, they have chronic conditions. They need to get preventative care to prevent illnesses, be screened for cancer, to see their pediatrician and get their shots. We don't want to go through COVID and then have an epidemic of measles or meningitis because they weren't getting their vaccine, which could very well happen, in especially areas where people stopped going to the physicians during this, and then they didn't get their preventative care. We could see kind of a secondary outbreak of other diseases, and that would be sad. So I think that's important. So
just a lot like the fire department in New York and the police department in New York after 9/11, you guys are the front line of defense as far as dealing with pretty heavy stuff. And yes, you're a doctor. Yes, you deal with the unfortunate truths of people being sick and passing away. And that's what happens in the medical field. But how do you think these professionals, be it nurses, be it doctors, healthcare administrators, janitors, how are they feeling, and what could citizens do, or what could we do to help alleviate that? Because again, you guys are at the front line, you guys are heroes, and we want to thank you for that.
Yeah, I appreciate that. That's great, and all the doctors and nurses and everybody else that works in our system, thank you for that. But really, it's been amazing. Part of our planning for the worst is we're going to need more doctors to work in the ER and in the hospital. So we asked for a list of volunteers who don't normally, maybe they're a family practice in an office, and would you volunteer to work a shift in the ER or a shift in the hospital? And really a large number of our providers signed up, and we haven't needed them, knock on wood, at this point.
Yeah.
But that shows the drive they have to help people, and so I think that's a strong, very strong thing to me personally.
That's right. So I think that there have been protests all around the country wanting to reopen the country. The economy has been pretty bad, obviously for obvious reasons. I think even here in San Angelo, people are getting a little antsy, saying, hey, we've had 3 or 4 weeks. What could you tell those citizens about what's going on in places like New York, where, in my experience, I was hearing an ambulance every 2 minutes outside my apartment window. I saw a temporary hospital being built in Central Park or in the biggest convention center. Is there anything that you could tell people who may want to go back to work or may want to be back to their old normal, to kind of, I guess?
This is a tough one, because it's a fine line between, you don't want to go back to work and then get your coworker sick who maybe is older or has other conditions, and then they succumb to that. So nobody would want that, I'm sure. But that's a good question. How fast can we come back? I think you have to look at history a little bit, and I know people have already done that. But you look back at the Spanish flu back in the early 1900s, and it was pretty bad. It was really bad. The people got back to work, and eventually it it dissipated, and there were no vaccines back then, but it ran its course, so to speak. So I think in the long run, that's what will happen.
Yeah.
We may have to battle this for a little bit, but it's not
Exactly.
forever. And so we can, I think, plan on eventually getting back to pretty much normal.
Yeah.
In the short run, though, I think we have to be careful about large groups of people getting together, and that's going to be difficult with football games in Texas, right? Friday night,
exactly.
high school football, and you got 20,000 people.
It's hard to fathom.
It's gonna be tough, yeah.
Not having football games, but it's a very real thing.
But that's what people were thinking about. Can we play games to an empty stadium? Is that possible? So I've been impressed with how many people are thinking, of new ways to do something. I mean, we've all learned how to do Zoom meetings now, right? And telemedicine, in our case, with medical field, has become really strong, and I think we'll continue from now on. I think we'll have telemedicine.
You're going to build on it out of necessity. It will this new innovation. Not that it was new, but
sped it up.
Exactly.
It sped up the use of it.
Yeah.
Because it was sort of like a tool we had, but nobody used it very much. And now the patients are more comfortable with it. We're more comfortable, and so telemedicine is going to be. We'll be in good shape with telemedicine going into any future situation like this. You can't do everything. Obviously, you can't do surgery over telemedicine, but there's a lot of things you can do, and that's been good. So I think innovations, different ways to do, different ways to shop. I know people are ordering more ahead of time, and they show up at the grocery store and they get their order picked up, so to speak, outside. I could see that continuing for the future and being good, good for their business and good for the customer. We're looking here at, we're not looking, we're already doing this. We're having what we call a waiting in the car waiting room. So you drive up and you contact the nurse that you're here in the parking lot. And then when it's time for you to be seen by the doctor, they'll text you on your phone, and then you come on up and they put you right in the room. So there's no waiting in the waiting room where that again helps. So that I can see that going forward in the future and being a pretty commonplace thing where you have a waiting in the car waiting room approach, and I think people would like that.
Awesome.
And just you can do a lot of things in your car that you can't do in the waiting room, right? You listen to the radio or listen to your podcast and listen to your podcast if you have one, and read a book, whatever. So it'll be some. There's going to be some real good innovations that come out of this. It'll be positive for patients and everybody, really.
And a couple of last questions before we wrap this up. But what does the hospital need for? I feel like I've seen Dr. Fauci and the different medical professionals say that we really can't go back to the way things were, or we even can't go to a new normal without testing and having the ability to test. And if I'm correct, there hasn't been a lot of testing done even in Texas. But is that true? Do you need testing?
I think there's a couple of ways to look at it. Testing, large scale testing would be really beneficial to see what the whole population, how many people in Tom Green County really ended up in the end having, was it 5%, was it 3%? That's what large scale testing would help with. It doesn't really help per se on an individual patient right now because most people that have it aren't really that sick, and so the way we do it right now is if you get tested, you're supposed to stay home and be quarantined until the test comes back, and so it's not going to change, it didn't really change that much. And if you tested let's say you tested a large population, say a company tested all their people that work there, and maybe they all came up negative. Well, what are you going to do next week? Do we test them again?
Yeah.
It would be like testing you for the flu. Or the other example I've heard is a pregnancy test. Okay, you can run a pregnancy test and you're negative. Well, that doesn't mean you're not going to be pregnant next week. Do you run one? So there's a part of testing which has to do with the individual patient and then there's a testing which has to do more with epidemiology and looking at the whole population and really looking at numbers, and that does help you plan and you know what supplies you need for next time. If you know, okay, here's the real numbers now. So the model we used here at Shannon was a pretty it was one of the models that was developed out of New York, basically, and it showed us here we were going to have to probably double our bed capability and double our ventilators and et cetera. And so we planned for that using that model. Now, luckily, it turned out the numbers didn't, that model didn't turn out. It's like Dr. Fauci has said that.
Yeah.
A model is only so good until the data comes in, then you have to reassess the model. So having more information, I think, would give you a better model. So the next time we could go, okay, this is more likely what it would be like in West Texas versus.
And are you guys performing, I know that they're not necessarily scientifically proven, but antibody tests?
Yeah, the antibody test is a little bit like that. It's not, there's not many FDA approved tests, first of all. There's a lot of tests out there that are not been validated by the FDA. And so what that means is there's going to be some false positives and false negatives. So again, doing an antibody test on, say, if you were negative, it could be falsely negative. Maybe you really were positive, or vice versa. It shows you're positive, but you really weren't. And so what are you going to do different? Are you going to stop wearing your mask? Or are you going to start just going around, hugging everyone?
Yeah.
Probably not. So it doesn't really change anything that you would do. So again, large scale antibody testing, I think, would, again, back to epidemiology and studying the population. That's where that would be. I don't see where it's really that helpful for one. Like if I knew I was positive, I'm not going to stop, wearing the proper equipment, because you just can't trust it. Or from other diseases, you can have positive antibody, but it may not be enough to be protective.
Yeah.
So there's different levels, right? So you could have a level that's still not safe. So it's just not enough known about it yet. And I think it's going to be something down the road that maybe will become useful, but I don't think it's that useful right this second.
And so lastly, today's May 1st, and it's actually, I think, good timing that I'm able to talk to you, because Texas is one of the 11 states that has loosened some restrictions. So I think movie theaters, retail stores, restaurants, other places, bars, no bars, no large events. But what would you tell those people who may be a little bit hesitant or want to go out? Do you have any advice for San Angeloans or Texans
I think if you go out and let's say you go to a restaurant and the rules that the governor set out, I think are really very conservative and pretty good. So they can only have 25% of their capacity, I believe, and the patrons have to be 6 feet apart. So the tables are going to be placed, in a way where I think it'll be safe to do that. And I think the recommendation is still for the public in general to wear a mask, like a cloth mask like I have here, and then that would be good too. And again, like I said, I want to reiterate it is very important to. One thing that hasn't been restricted is to go see your doctor and get the care you need. So that's one thing. We do believe a lot of people are staying home because they're scared to come out, and it's really they're missing out on care that they need to get. So we do want to make sure they do that. Going to church, that's another one. I think the governor's opened up with a lot of restrictions on the number of people and then the spacing, and I think that's an important part of the culture in our area. And so I think that'll be nice to see if that can work. And
it'll be interesting to kind of show this interview to people in New York and all over the country, because they'll be like, well, Texas is opening up, but all last week it was all Georgia, and we're in New York, we're not looking until June 15th. So it's interesting to see how the different states are attacking this. And I do feel like Texas is being pretty conservative with that. So
I think they are, and again, the numbers, continue to watch closely on the numbers, and obviously at any point, if we need to, backtrack, then I'm sure the governor will do that. And I know they're going to be watching this very carefully as it goes. And I think he has a phased approach to open up gradually, and that's kind of what happened with us with surgery. He opened up the surgery back on the 22nd of April, so that's been, basically almost 9 days now. And he opened up, people that need surgery that, it wasn't an emergency, but they still need the surgery, but it was being put off. Yeah. Now they could get that. And so that was sort of for us at Shannon, that was a way for us to open up and start doing, what people need to have done. And so far that's going very well. Again, everybody's protected, or all the staff wearing masks and patients wearing masks. We're using all the protections that we need to do those surgeries, so it'll be very safe.
Well, Dr. Schultz, thank you so much.
Yeah.
He is the Chief Medical Officer for Shannon, and you've been extremely helpful, and you were by far the best pediatrician I ever had. And go Tigers.
Go Tigers.
Thank you so much.